Today's episode about eyeballs is brought to you by the Nuance Dragon Ambient Experience, or DAX for short. This is AI-powered technology that helps physicians be more efficient and reduce clinical documentation burden that causes people to feel a bit overwhelmed and burnt out. To learn more about how DAX Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discover DAX. That's nuance.com/discover DAX.
Knock, knock, hi.
Knock, knock, hi. Hello, everybody. Welcome to Knock Knock Eye with me, Dr. Glaucoma. This is your one-stop shop for all things eyeball related. It's been a week since we last talked. Did you do the homework I sent you? I wanted you to review your anatomy. You should always review your anatomy before we do these episodes. It would just be really helpful. I hope you allow me to toot my own horn a bit here. Like, do you have any idea how hard it is to talk about these eyeball conditions without being with you and showing you a very detailed a picture or model of the eye? Those of you who are listening to this on the I don't have an excuse for those of you who watched it on YouTube. I'm just lazy. I don't have a model with me, but for those who are just or listening to this on your commute or wherever you happen to be listening, it's hard sometimes. I have to try to do this in a way where you don't have to actually look at the eye, but we all know we have an eye, so you can kind of imagine what the anatomy is like. I'm just saying, I'm impressed with myself sometimes that I can talk about these things and you don't have to actually look at the eye. Actually, that might be a good thing for some of you, because I know some of you think eyeballs are gross. It's a thing. People think eyeballs are gross. People think lots of parts of the body. I think respiratory secretions are disgusting. I don't know how anybody could be an anesthesiologist. Some people have a thing about eyeballs. But if that's the case, why are you even listening to this? I'm glad you are. I'm just curious why. Anyway, we're going to continue doing this without any kind of reference to the eye. So that's why you should always look at your anatomy. Just look at yourself in the mirror. That's good enough, right? And you can see 25% of the eyeball just looking in the mirror. I think you get a pretty good sense of what things are going on in there. Anyway, all right. So we're going to do a little popery episode today. I got some questions from you guys I got to get through here. And some of them are more serious. Some of them are less serious. But they're all very important. And first off, I do appreciate all of the feedback and the questions. Some good questions. Some very confusing questions. Some I don't even really know what you're asking. They're more of comments than questions, which is fine. All right, this is not an academic conference. I'll accept that. That's okay. And so let's do maybe a little video recap first. What let's see. I've done some videos recently. What was the last one I did? I've been I decided to start. I don't know if you guys have seen this. I think I've done 3 of them so far. I tried to take on the greatest challenge and a doctor comedian can ever try to take on. I'm trying to force my followers to learn metabolism pathways. That's right. I've done a couple of these now where I try to trick you into learning about the Krebs cycle, about glycolysis, about gluconeogenesis. In doing this, I myself have also learned about them. If you look at my Google search, pentose phosphate pathway is in there. The things I do for content, you guys, it's just, anyway, so I've done those are good for me to do on the road too. If I'm doing a lot of speaking, I don't have all my props and stuff with me, then I think part of being a content creator is just trying stuff out. It's not always going to work. I've definitely done some things that have not worked, unequivocally passed over by all of you. And that's fine. That's, you know what? It's a learning process. All right. I am here providing free entertainment because I love it. All right. And so it's, some things catch on. Like, let's see, what were the series of videos I've done that have really caught on were like the first day of rotations, the interviews, the residency interview things, and oh gosh, it's getting late. The therapy sessions is what I'm thinking of. Like those were the things that like really caught on. I could do a lot of them. I'm not sure how the teaching the audience metabolic pathways, if that's really going to catch on. The jury's still out on this one. So I'm not running out of ideas, but sometimes I kind of, have to like look in the barrel, kind of shake it around just to get a sense for how many ideas are in there. We do have some fun stuff coming down the pipe though. So I'm excited about that. I'm kind of all over the place right now. That's how I feel because it's been a long day. Today was a surgery day, and surgery days are fun for me. They're long though. So the way it works is my first surgery is at 7:30 in the morning, and we go until like 11:30. So probably do I think today I did 11 cases. And then I see post-ops and some clinic patients in the afternoon. So I operate for a full half day, and these are 7-minute surgeries, 8-minute surgeries. So that goes quick. It's fast-paced, so which is why I like it. Like I could never do the long neurosurgeries, even like ortho stuff is too long for me. ENT, we're getting closer. They got some pretty quick ones. All right. I saw them, how long it took for them to put tubes in my kids' ears. That goes fast. But there's nothing like ophthalmology. Those being able to do a full day of 7-minute surgeries, it keeps things moving, keeps things going along. And I love just seeing the happy patients like the next day. It's great. It's fun. But it's tiring. It is exhausting. It doesn't sound like it, but it just is there's a lot of just mental effort to doing surgery, I think. Especially you have like one or two cases that you're maybe a little bit nervous about, or just maybe not nervous, but just really locked in because it's maybe not a particularly healthy eye, or it's just going to be a more difficult surgery. It's something a little bit more complex. These things they take a lot more planning, a lot more thinking. You think about it a lot. And then, maybe you got a little bit more adrenaline pumping, the blood's flowing during the surgery, making sure it goes well. So it's not so much nerves, but you're I don't know how to describe it. It's more locked in, like you are using a little bit more energy. And so you feel whenever you finish operating for the half day, then you come down from that and you relax a little bit more, and then you feel sleepy. And if I'm lucky, I get to take a nap. But I did not get to do that today. So I'm a little tired. So I apologize if I feel like I'm kind of all over the place. I was going to do optic neuritis today, but that's like a really in-depth topic. There's a lot to discuss, and I don't think I have the mental fortitude to get through that right now. So I'm going to save that. It's coming soon. I promise. I promise it's coming soon. I've had people ask me about optic neuritis, multiple sclerosis, that kind of thing. That there are a few big topics in ophthalmology that it's going to take. I got to plan it a little bit more. So that's one. Horner syndrome is another one. There's a lot to talk about with Horner syndrome. All the neuro stuff. There's a reason I'm not a neuro-ophthalmologist, you guys. It's hard. It's just hard stuff. Oh, it's difficult. So I love it when you give me softballs. All right, so let's take a quick break, and we're going to get into some little ophthalmology potpourri. How about that? Okay, here we go. So, ophthalmology potpourri. I'm going to start with this is a very, very serious topic. Okay. I want to make sure we have the right mood for this because I don't take this type of subject lightly. This is something that a lot of people experience, and it's it's a topic that you have to be careful with. It's something. It's a delicate situation, and with patients who have this, sometimes they're not quite ready to hear the truth, and so I have to be careful talking about this. I'm going to answer this question. Thank you for asking it. Aaron asked this question. He says, "Oh my God, has Will done an episode about weed yet?" This is going to be a challenge. All right, this is very serious. All right. Aaron goes on to say it would be really fun having him explain why our eyes get red when we're stoned, and what eye drops do, and maybe some claims that might not be true about your eyes and weed. Thank you, Aaron, for this very serious topic. I'm thrilled to indulge you and to explain all things marijuana to you all. All right. I'm sure you've been dying. You've been waiting for this. And so let's get into it. All right. So first of all, why does it make your eyes red? A lot of people think like you smoke weed, it's the smoke. It's the irritation from the smoke that's causing your eyes to be red. But no, that is not it. Because if you have an edible, your eyes will still get red. All right, so why does that happen? Well, when you have THC, marijuana, maybe CBD as well, I don't know. Your blood pressure lowers. You get a little bit of an anti-hypertensive effect. All right, so your blood pressure lowers, and what happens when your blood pressure lowers? Well, what's going to happen is your veins, your small blood vessels in the body, they will dilate to allow more blood to get to the end organs, the tissues, the skin, all the way to the eye, the conjunctiva. And so the vessels on your eye will dilate. And that makes it look like you got red eyes. But really, it's just your eyes dilating, allowing more blood flow to get to the eyes. And that's a response to a drop in blood pressure. All right. So that's what's happening there. That's why your eyes are red. So what do people do when their eyes get red? Well, some people go out and buy Visine. Now, we've talked about this. I had a whole episode where I discussed why I hate Visine so much. I will recap for all of you. So Visine is a medication that has several things in it. It has tetrahydrozoline, which is a potent vasoconstrictor. It's potent enough that it can kill a person if you ingest it. So what it does is it constricts all those blood vessels, all right? And if you drink it, if you absorb it systemically, it can constrict the blood vessels in your heart and give you a heart attack. So that's what tetrahydrozoline does. That's what what Visine does. Clear Eyes, Rodo, they all have this ingredient in it. And it's effective for people who are trying to hide their marijuana smoking or ingesting habits from somebody. And so they take Visine, constricts those blood vessels. The problem is that it only constricts them temporarily. And then when it wears off, the blood vessels come back and your eye is more red than ever before and feels bad. It feels irritated. And then you just end up having to use more Visine. So you get into this cycle of constantly using Visine and it wearing off and using more of it and more of it. And you get in this cycle, and it's good for Visine because they sell a lot of Visine, but it's bad for your eyes. All right. So I encourage you. I always joke, like the only indication where it's okay to use Visine is when you're hiding your pot smoking habits from your parents. That's it. Or whoever you want to hide it from. All right. I don't think you should hide it, though. I think you should come out with it. Just let the world know. All right. It's 2024. We can get over it. We're fine. Marijuana is legal in however many states now. Like, come on. It's fine. We're okay. All right. And then the other part of that very serious question from Aaron is, any true or false claims about marijuana and your eyes. So everybody asks, not everybody, I've had maybe 3 people ask, is marijuana an effective treatment for glaucoma? Because we all heard of medicinal marijuana, and yes, there is an eye pressure lowering effect, because that's what glaucoma medications do. They lower your eye pressure. So yes, marijuana does have an eye pressure lowering effect, but there are roughly 40 different treatments that are better and just as easy, maybe not as fun, but are just as effective or even more effective than marijuana. All right, from eye drops to lasers to more eye drops to newer eye drops to procedures to surgery. There's all kinds of stuff. All right, it's just not an effective glaucoma treatment. So it's not first line, it's not third, fourth, it's not 10th line treatment. I've never tried to get someone medicinal marijuana for glaucoma because it's just not an effective treatment. Yes, it might lower your pressure a bit, but it's just easier ways. There's just easier ways. Not as fun though, right? Okay. That's really it. There's no other like benefit, potential benefit to of marijuana, THC. I don't know enough about CBD. I don't know. That's a different thing, but I'm not aware of anything there. All right. Thank you for that, Aaron. You know, his name sounds suspiciously, it's spelled the same as one of our producers. So I am somewhat suspicious that maybe he dropped that one in himself. I don't know. He'll have to come clean if that's the case. All right. Let's see. What else can we talk about? Let's see. We did that. Oh, let me pull up. I was looking at, you guys had some great comments. I recently asked on a community post on YouTube for some questions. So here, let's go through a few of these. So we have at Jessica Freeze 8504 said, curious if those look at a distant object for 20 seconds every 20 minutes. Eye ergonomic tips are actually good advice for computer users. Yes. The 20-20-20 rule is something I told someone about that today in clinic. You should, the general rule of thumb is if you look at a computer a lot, really doing any kind of near work, every 20 minutes, you should look 20 feet away for 20 seconds. That's the rule. And the reason why this is so helpful is because when we look at screens, we don't blink as much as we are supposed to. Our blink rate goes down. We've seen studies that have shown this. And so by looking away from the screen, it reminds you, it stimulates you, oh yeah, I should probably blink. I should probably lubricate my eyes. And so that's part of it. Also, the looking 20 feet away thing, it relaxes the muscles in your eyes. All right, so you have this ciliary muscle that helps to constrict, to accommodate, well, it does constrict, but it also accommodates your vision. You're focusing up close on a computer screen. And those muscles can get tired out. And when they get tired out, you start to get a headache. And so looking away, you're 20 feet away, just for 20 seconds, it allows you to relax those muscles just for a brief period of time, reset, and then go back to your work. All right. So, you do the best you can. It's easy to get, I'm guilty of it as well. You get kind of sucked into your, whatever it is you're doing. But it is a good rule of thumb. So there is truth to that. There's data behind it as well. It really does help. All right. What else? Got some good ones here. A lot of people recently have asked about ocular migraines. Check out the last episode. Just talked about that. One person, so at mknight9251 said, are there exercises a person can do with their eyes that would put off the need for getting reading glasses? No, I'm so sorry. No, it's inevitable. We all will need them someday, and it's a big reality check. It is one of those things. It's coming for me. It's right around the corner. Sometimes I can feel it. I'm starting to get strained. I'm starting to get a little bit of headache. If I look at my phone for too long, and I know that's what it is. And I'm dreading it just as much as everyone else. So I sympathize with all of you 40-year-olds out there. All you people, I'm right there with you. All right. So, but no, you'll hear about like supplements and, there's people will try to sell you anything. All right. This is just life. It's just age. It just look at it this way. And ever since I had a cardiac arrest, I always try to think about things in this way. I think like I am so glad that I have survived to the point where I need reading glasses. You can do it for anything, right? I am so glad I have survived to the point where, I can have an argument with my, near teenage daughter, my preteen daughter. It's kind of at times it's kind of a funny way of looking at things, but it's kind of true. Like, yeah, this situation kind of sucks, but man, like think of all the people that don't get to experience this at all because of whatever horrible thing happened in their life. And so it sucks, but man, at least I'm here. Getting to experience this terrible thing in my life. But it's still life. You're still alive. You're still experiencing that. So I don't know. Take it or leave it. That's just my own personal approach to the abject horror of needing reading glasses soon. So I'm with you. I'm with you on that one. Let's see. There was another. Oh, I love this question. At Emily V12 says, deeply trivial. It's always a great way to start with a question. Deeply trivial. But hey, these are YouTube comments. Like nothing's, who cares? It's all, it's technically all kind of trivial, but whatever. Deeply trivial. But if you poke yourself in the eye with a mascara wand, where does the mascara go? I love this. So, the big chunks of it will get, it'll get in your tear film, and some of it might land like on your eyelid margin. So not on your lashes, but like above the lashes where the eyelid touches the eyeball. If it's small enough little particles though, it'll go through the tear drainage system. All right. So the tears, the way they drain is when you blink, you're pushing your tears into the tear drainage system, the nasolacrimal system. So you have little holes on the upper and a little hole on the lower, right by your nose. And what happens is those holes, they connect kind of immediately right there on the inside of your nose. Right? They connect there, and then they empty underneath what's called the inferior turbinate. So you have these things called turbinates or turbinates. I don't know how to pronounce it. Ask an ENT doctor. But you have an opening. That's where the tears drain. All right. So that's why when you cry, all right, when you've been sobbing about it's been 6 days, like when am I going to get another Knock Knock Eye episode? Just wait one more day. It's going to be there every week. I get this to you. You don't have to cry about it. It's fine. Whenever you do that, those tears will drain into the nose and you'll get a runny nose. That's why you get a runny nose when you cry. You're just making a bunch of tears. They got to go somewhere. All right. Some of them are running down your face. All right. But a lot of it gets drained into your nose and you start to have a runny nose. All right. So that's why you're having all that. So that's where your mascara goes. All right. It'll come out of the eye. The eye is really good about getting stuff out of it. All right. Especially like little pieces of debris or dirt or stuff like that. All right. You'll blink it out. It'll get out. It'll get out. Just try not to poke yourself in the eye. That's hard. I'm really impressed actually that I don't see more mascara and eyeliner pencil accidents. Like maybe you're just not coming in. Maybe you're all just tough. You're just like, whatever, I've done this 1,000 times. I don't see as many as the number of people out there that wear makeup. I really would expect a lot more makeup pencil accidents, but I don't. I've seen a lot more fake eyelash accidents. Not a fan. I know you guys love the fake eyelashes. Not a fan. Really don't like those because I see when it goes wrong, right? I see when it goes wrong. And then here's another question. Really curious to ask if there were this is from @TechnoDGent said, really curious to ask if there were any rare observations or overall unique cases, eyeball cases in your experience. I've had a number of them. When I read that earlier, the first thing that came to mind uh, was a patient that I saw in residency, and is very rare and very sad actually. So this is real, not like fake, like marijuana sad. This is like real. It was a very unfortunate situation. It was an elderly gentleman who had a spinal surgery, and some of these spinal surgeries, you're face down for an extended period of time. And I think there were this gentleman, he wasn't the healthiest patient. So I think there was issues with bleeding, with blood pressure control. And so it ended up being a very long case. It was like a 12-hour case. And this patient was face down for 12 hours. And what can happen is if, for a variety of different factors, what can happen is you can lose blood flow to the back part of the eye. So the way this can happen is if you're face down long enough, you can imagine, like, when you wake up in the morning, your eyes are all puffy. That's because all the blood's been pooling up toward the top of your head. All right. You've been supine, you've been laying down. So when you're standing, when you're walking around, all the blood goes down. Right. And so you get less puffy. But when you wake up, you're a little bit puffy. Well, same thing happens if you're face down during a long surgery. Is a lot of the blood will pool in the face and in the eye and the orbit, and so all that vasculature, all the veins, they get full of blood. And you can imagine you have to still bring oxygenated blood into that tissue, but it requires more effort. Right? Think about it. Like if all the blood is backed up in the veins there, well, then the artery, the body, the heart, the vascular system has to work harder to get more oxygenated blood into that tissue. And then, so you have to do that. But what if the patient is having bleeding, or they're hypotensive? Then the body doesn't have a lot of capability to push harder to get that blood up into that tissue. And so it's kind of a perfect storm of problems during a long surgery where a patient was face down and ended up, for an extended period of time, losing blood flow to the back part of the eye, the optic nerve, specifically the posterior segment of the optic nerve, and had what's called a posterior ischemic optic neuropathy. The patient woke up and was blind. Had what's called what we refer to as like hand motion vision. So he could see kind of a hand moving in front of his face, but that was it in both eyes. And it's not the type of vision that comes back. Not the type of injury to the eye that gets better. And it's also extraordinarily rare. So I don't want people to like be very scared. If you need a spine surgery, get your surgery done if you need to. But this is like a 1 in a million type thing that happens. So it's very rare, and it's a known risk. And so it's something that even like the surgery team, what they do, they're very careful. They know this about, neurosurgeons are aware of this, about whenever the patient is face down, making sure there's no pressure on the eyes themselves, because that's another way that you can get this is you have pressure on the eyeball, and you increase the pressure enough in the eye, blood flow is not going to get to the eye. And so you're going to have problems. And so making sure when you're face down that the face rest is on the bones of the skull and not on the spongy eyeball. All right. So that's another thing. But yeah, it's very, 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 very rare. Okay. And so, I really don't want to, people can get very scared about eyeball things. Don't be scared about this. This was a tragic, it was really an awful thing that happened. And it was, those kind of things do stick with you though. Like I read that comment and that was the first thing I thought of. And so it's and these are things that these are patients and events, and I've got a number of them, and I'm sure throughout the course of doing this podcast over the next however many years I do it, I don't know, as long as you guys keep listening, I'll keep making them. Then I'll tell you about all those, the patients that stick with me, that I'll never forget, that even when I'm an old demented man, thank God I can live to be old and demented, right? See, that's how it works. That's how my brain works after the cardiac arrest. I'll be old, I'll be dement, I'll have terrible dementia, but at least I'll be alive. I'll be alive. That means I got to be an old man who's demented, right? Anyway, it's health, near-death experiences kind of mess you up a bit. You get through it the best way you can. But anyway, every physician, the point is every physician has those. And those are the ones we think about first. There have been hundreds, if not thousands, of patients that I've helped to see better. But it's the ones that I couldn't help, that are the first ones that come to mind. And that's really, it's a cruel trick that the brain plays on you, right? That I wish that wasn't the case, but it's just human nature. It's just like, we're going to think about those. Those are much more traumatic, and they're at the front of your mind more than the wins, more than the great outcomes. So anyway, I shouldn't have had that be the last thing I tell you guys. But then the next question is somebody asking about the physics of rods and cones, and I'm just too tired. We'll get into visual photo transduction some other day. All right. I can't do it tonight, you guys. This is it. All right. So, thank you all. Thank you for the comments. All right. Keep giving me those. I look at the YouTube comments. I don't have time to like all of them. What am I talking about? It takes like 2 seconds to like a comment. I'll do better. But, this has been a lot of fun for me, at least. Thank you for listening. I am Dr. Glaucoma Flecken. Special thanks to my producers, Rob Goldman, Aaron Corney, and Shanti Brook. Editor-engineer Jason Portizo, who's got some editing to do on this one because my phone went off earlier. And music is by Omer Benzvi. So again, let me know what you thought of this episode. What resonated with you? What do you not like to hear? Do you hate the goopy, gross stuff? Because I can cut that stuff out. Do you like the goopy, gross stuff? I still haven't done my all things parasite episode. There's a lot of parasites that can get into the eye, and it's kind of fascinating for me as well. So anyway, that's it. Thank you all. This is a human content production. I'm just tumbling down toward the finish line here, so I'm just going to say goodbye.
Knock, knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.